striking the metronome in morphometric analysis of glaucoma, shifting from BMO HRW to BMO MRW, no financial disclosure. The three pillars of glaucoma diagnosis are function, morphology, and intraocular pressure. This video theta focuses on morphometric assessment of the optic nerve. It has been decoded with Spectralis workflow for better initiation of glaucoma module premium edition. Box diagrams will be used for majority of the slides as seen on the right lower corner to reorient the anatomical locations. RP is over BM, BM is over choroid, choroid is over the sclera. Framework of this video theatre involves: what is the true margin of the optic nerve? What is Bruch's membrane? What is Bruch's membrane opening? What is Bruch's membrane opening minimum rim width? How is it different from Bruch's membrane opening horizontal rim width? What are the alpha, beta and gamma zones? What is the true margin of the optic disc? Clinically, the inner edge of the sclera, Elsning ring, is identified as a disc margin depicted by the green line while performing ophthalmoscopy or fundus photography. Whereas, in OCT, the termination of the Bruch's membrane, known as the Bruch's membrane opening, is identified as the disc margin depicted by the red line. So, now we are left with two disc margins, the Bruch's membrane-based disc margin shown in red and the clinically assessed disc margin shown in green. When there are two disc margins, then we will have two areas within the margins. 1. Clinical disc area. 2. Bruch's membrane opening area. It is well documented by Amini et al. That clinical disc area is way larger than the Bruch's membrane opening area in normal as well as in glaucomatous eyes. Two swords cannot be in single sheath. So, which is the true boundary of the disc margin? Since blood vessels and axons cannot pass through the Bruch's membrane, termination of it is the true boundary, putting all speculations to rest. Reorienting the anatomy of Bruch's membrane. Bruch's membrane lies in between the retinal pigment epithelium and choroid. Retinal pigment epithelium lies on top of it, choroid lies below it. The Bruch's membrane has two configurations. If the Bruch's membrane extends beyond the Elsning border tissue, it is called internally oblique configuration. If the Elsning border tissue extends beyond the Bruch's membrane, it is called externally oblique configuration. Appearance of Bruch's membrane. Histology versus OCT. In OCT, the thickness of Bruch's membrane and RPE appear to be more or less the same, but in reality, that is, histology, thickness of Bruch's membrane is only 1/3 of retinal pigment epithelium thickness. So, why does Bruch's membrane thickness vary in OCT? It is due to the principle of OCT, which detects the reflectance of bounding surfaces. Bruch's membrane consists of 5 layers. High reflectivity of each boundary causes it to appear thicker in OCT. This is an electron microscopic picture of Bruch's membrane showing its 5 layers. Bruch's membrane opening. Imagine the retinal nerve fiber layer projecting into the optic disc like the water falling into a waterfalls. This helps in understanding the concept better. With Spectralis Glaucoma Module Premium Edition software, there are 24 scanned lines. So, totally 48 BMO positions are detected along the optic nerve to determine the BMO-based disc margin. The BMO-based disc margin should be smooth as seen on the right side, whereas on the left side, the margins seem to be irregular, indicating an erroneously performed test. The green line is the segmentation of internal limiting membrane. The red line segments the Bruch's membrane with the Bruch's membrane opening depicted as a red dot. The 360-degree scan of the optic nerve with BMO is shown on the left side. How to find the Bruch's membrane opening in OCT? First, detect the green wedge-shaped ending of the choroid. BMO will be seen to lie just adjacent to it. Bruch's membrane never ends before the choriocapillary's ending, whether it is an internal oblique or external oblique configuration, but Bruch's membrane can extend further than choriocapillaries. In a real-time scenario, the ending of the choroid is shown in green and the minimum rim width is shown by the blue arrow. Let us see a 3D animation of Bruch's membrane opening minimum rim width. Once the internal limiting membrane, Bruch's membrane and Bruch's membrane opening are segmented, this 3-dimensional angle beautifully reveals the Bruch's membrane opening minimum rim width. Bruch's membrane opening minimum rim width is the smallest distance between the Bruch's membrane opening and the internal limiting membrane. The Brooks membrane opening minimum rim width follows the ISNT rule. It is thicker in the inferior and superior quadrants. But every decision for something is a decision against something else, as revealed in Dark, seen in Netflix. Let us see why minimum rim width was chosen over horizontal rim width. Chow and et al. Revealed that BMO minimum rim width yielded a higher diagnostic performance than BMO horizontal rim width. Also, sensitivity of the BMO minimum rim width was consistently higher than RNFL and BMO horizontal rim width. A study done on glaucomatous neuroretinal rim tissue revealed that the mean deviation of the visual fields correlated better with BMO MRW than with BMO HRW. Also, the retinal nerve fiber layer thickness correlated better with BMO MRW than with BMO HRW. The curse of the optic nerve head is its variability, as many different sizes are available. The size of the optic disc influences the neuroretinal rim size. Imagine a large disc and a small disc having same neuroretinal rim area. Large disc will still have a small BMO MRW and small disc will still have a large BMO MRW. The influence of the disc size on BMO MRW should be kept in mind while interpretation. As we have seen before, different persons will have different optic nerve heads. Categorizing the optic nerve head may be challenging. Ideally, the BMO margin matches the clinical disc margin. So, there will be no hyperreflectance surrounding the optic nerve head in OCT. In challenging situations, when BMO margin does not match with the clinical disc margin, hyperreflectance occurs surrounding the optic nerve head. Example, peripapillary atrophy, conus temporalis, PPA with conus temporalis. The alpha zone is where BM and RPE are present, beta zone is where only BM is present, gamma zone is where no BM and no RPE are present. In peripapillary atrophy, RPE ends before the BM, producing hyperreflectance. In conus temporalis, RPE, BM and choroid end together before the sclera, producing hyperreflectance. In PPA with conus temporalis, Brooks membrane ends in between the RPE ending and scleral ending, producing hyperreflectance. With spectralis, there is a dual beam scanner to detect minute eye movement during performance. Also with GMPE, same piece of tissue is examined during follow-up, which is very important to detect glaucomatous progression. With the anatomic positioning system, first the foveal centration is marked, then the BMO centration is marked, then fovea BMO axis is plotted, followed by the 24-line scan examining 48 BMO positions, followed by a circular scan examining the retinal nerve fiber layer thickness, and finally we have the examination of ganglion cell layer. Glaucoma Module Premium Edition has indeed opened doors for a new world in glaucoma diagnosis. Thank you.